Hello and welcome to Healthwatch. I'm your host, Carolyn Wilson from Light Health District. The goal of this program is to bring you information on a wide range of public health topics and to introduce you to the people doing great work across the community. Today, I'm joined by Margaret Lancaster and Trish Rios from the NLC Cares Initiative. And today we will be talking about Mental Health Awareness Month and peer navigation. Margaret and Trish, welcome to the show.
Thank you.
So I'm so delighted to have both of you back on the show. You have both been former guests, so happy to have you back. And today we're going to talk a little bit about mental health awareness and the Peer Navigator program. We, I believe in the past, have talked about a little bit of the opioid work that we do, some of the peer navigation there and some of the harm reduction work. So this is not dissimilar to what we've talked to in the past, but I'm really excited to have you back. So for those of our viewers who don't remember you or are seeing you for the first time, I'd love to give you guys a chance to introduce yourself. Margaret, let's start with you.
I'm Margaret Lancaster. I'm a Senior Health Program Coordinator at Light Health District, also a community health worker and peer navigator.
Hi, I'm Trish Rios. I'm the Director of New London County Cares Navigators. I'm also a community health worker.
Awesome. So I've had the pleasure of knowing you and working with you guys for several years now. Let's jump into Mental Health Awareness Month. Now, Margaret, I see you're wearing green, which happens to be the theme color for Mental Health Awareness Month. And I know that many people have probably been seeing a lot on social media about Mental Health Awareness Month, different things talking about awareness and tips and reminders. What are some of the messages that you're seeing that are resonating with people?
I think what I've seen a lot this year, and it's really important, is like trying to break the stigma that's attached to mental health and encouraging not just people, adults, but like talking about it for kids as well. And I think that's changed. That wasn't talked about a while ago, and now it's more like breaking the stigma and how many people are affected by mental health.
And how much it matters. At this present time, there's so many things taking place in our world and how people are being affected by those situations and circumstances that are taking place, that those who didn't think they maybe had mental health issues, or even maybe the first time coming across an issue in their life that maybe brought on maybe trauma that initiated something that now has become something more than just the trauma itself, but maybe an anxiety or something behind it, is now being talked about more and being brought to the surface. And I see that also not only in young adults and children, but also now in some of our seniors.
Right, absolutely. And of course, I'm seeing messages all about mental health can impact everyone, sort of these inclusion messages to remind everybody that this isn't somebody else's problem, that this certainly affects more people than not at some point in their lives. So that's great. Happy to see a lot of that online, of course. Tell us a little bit about the NLC Cares program. We know about the substance use disorder program, but tell us a little bit about this peer navigation for mental health.
So I think we started out with the opiate use disorder, like focusing on the opiate epidemic, and then we realized how much mental health and substance use can go together. And part of our program that's a little different is that it's people with lived experience. So everyone that works with us, they all have had some experience with mental health, whether it's personal, family, friends. But I think we also bring the harm reduction approach to mental health conversations, which it looks a little bit different. We're not out diagnosing people, we're out supporting people and meeting them where they're at.
So important. Now, again, this is an initiative, NLC Cares, that spans between two agencies, and our other partner agencies, of course, but mainly Light Health District and Alliance for Living. How has that collaboration remained so important, and what does that really bring to this?
I'll say that because both agencies approach this in the same and on the same plane of understanding what the needs are for those who are in the community, and also seeing the evidence-based work around harm reduction as a whole, that the marriage, I say, between the two agencies that work so well is that all of us that work individually in the agencies, but collectively under NLC Cares, are all somewhat not only have lived experience, but also trained, and the directors of both programs have the same philosophy, and they look at the same ideology around how we approach the community with the needs and the services that we provide.
Absolutely, and we hear the term harm reduction. I think, more usually people are hearing it in terms of substance use. But it can also be applied to mental health and helping folks where they're at when it comes to that. Tell me a little bit more about the harm reduction approach with mental health navigation.
I think of it as being like the lowest barriers possible. So instead of like having to call us and make an appointment 3 weeks out, you call us and somebody's coming. No matter where you're at, whether you're in a home, you're outside, you're struggling at a location. It's just the lowest barriers possible for us to get to you and get you the services that you needed rather quickly. Usually instantly, within the same day, sometimes maybe 24 hours, but we just try to keep people safe and supported.
And not
Absolutely.
to minimize someone's experience.
Yeah.
Yeah, and not to minimize someone's experience at the moment, even if it's in that time, not to push it to the side, but even if it seems to, be something that maybe I need food right now, it could be critical to that individual and what they're experiencing based on that need. And we make sure that need is met as soon as possible.
So important. Yeah, it seems like, in the moment, being able to meet somebody where they're at in the community, like you said, not have to make an appointment is really crucial. Now, in this, we call this peer navigation programming. What role does lived experience play in all of this? What does that really bring to this? Do you think that helps when you're working with people out in the community? Are they more apt to buy into what you're saying, or to be cooperative, or to listen?
This trust is a trusted relationship that is formed, a rapport that's formed with individuals that can understand what other people have been for ourselves. And I think I speak not just for me, but I'll speak, Trish will speak for herself, or, understand what was done for me when I was in my lived experience. I took what I thought worked well for me from my individuals that assisted me. And then I kind of tweaked it to what didn't work well and brought it to a different level. So what would I want to give to someone in an empathetic way and face what they're going through, again, in my own life, or reflect on how I went through that myself and how differently I would want someone to approach me when it was being brought to my forefront.
And Trish, do you have anything to add?
Margaret pretty much said it, and I just feel like when you have lived experience, we have it. I don't want to say a language. Mm-hmm. It's just like an understanding. Like we have these neon lights, right? That not everybody can see, but the ones that see it, they know. And I think also, like Margaret said, it was really important to learn from not all the positives that I came across when I was in my situation, is making sure the negatives don't happen, right? And not being judgmental, not being dismissive, not being stigmatized. Those are the things that when I come to work, my goal is to support everybody and treat people like human beings, period. Good
goal. Now, talk a little bit about the outreach in the community. How are you engaging with folks? How are people getting a hold of you? How are you guys getting the word out?
We're everywhere. We are in London County. but I have navigators, myself included, that are out in the community, and sometimes it happens at a CVS parking lot. Sometimes it happens at a meal center. Sometimes it's just being at the right place at the right time. We have the navigator line that people can always call and text. And I always tell people, always feel free to text if you're not feeling like you want to talk, because some people don't want to talk yet, especially if they don't know us. Mm-hmm. But it's just being available and being out in the community to be there for people. And they're the most random places that we engage with people.
And sometimes it's agencies that are calling us for assistance because they don't have the maybe the capacity, one, or the training around working with individuals with mental health issues, or disorders, and understanding that we have been known in the community to be able to address those, and the trust and the rapport has been built. Some individuals in the community actually ask for us specifically. Call so-and-so, call Trish, call Margaret, call Donnie. Yeah, and then we show up, and that's one of the most important things, when you can be present for someone in their time of need.
And lastly, before we go to break, so we've been talking about mental health, and we do know about co-occurring issues, and we do know that some people deal with substance use disorders or issues, and then also mental health. What's the frequency you're seeing? Is it a lot of co-occurring issues that you're seeing? And it seems like the Peer Navigator program really can lend really well to both.
I mean, I think I've seen it in the last year or two. I've seen an increase of mental health, people struggling with mental health and not knowing where to go, where they knew where to go for substance use. But it's not an easy process sometimes for people to get the help that they need. So I feel like it goes together, but mental health is definitely different. We're seeing more people not necessarily using substances just because they're having a mental health, but then we also see people who may have a return to use after a long period of time because their mental health hasn't been addressed in a while.
Mm-hmm. And one of the things I do recall, I can say from my own experience, they weren't sure what came first. That's identifying what really came first. And I remember them speaking that when that was with my own experience. And then once I got into a therapeutic setting and was able to talk with someone, they were able to then identify maybe some things prior to my self-medicating, prior to knowing what my diagnosis might have been at the time and what it is. At that time, they were just, they weren't sure. So was how that sometimes works, is they get a little history from once you get into therapeutic settings to find out more about when the mental health might have been present in your life.
Great. All right, we're going to take a quick break. We hope you will join us right back here for more Health Watch.
I debate all day. It's what I do. But there are some things that are undebatable, like your mental health. I was in a dark place when my brother passed away in a car accident. I was depressed in ways I never imagined. I reached out, and my sisters came, my pastor, my therapist. They helped me get through it. I found that the more I spoke up, the healthier my mind became. When you love your mind, you can go so much further. Find mental health resources at loveyourmindtoday.org.
Welcome back to Health Watch. Today we're talking about mental health awareness and peer navigation. I'm joined by Margaret Lancaster and Trish Rios from the NLC Cares program. Welcome back. So we're having a great conversation learning all about this program, and I thought we could pick back up talking about some of the resources in the community. Now, this is a little bit different than what the NLC Cares program offers, but it's important for folks to know about the Child and Family Agency Urgent Crisis Center for Kids. Very important resource. There wasn't great resources before this. What are you hearing from folks about the importance of this new initiative and how needed it's been?
Well, I can tell you, they have gotten an influx of referrals. They have been really proactive in the community. Schools have used them. They do have the crisis center where the children and young adults can go immediately and be seen. The hours are very flexible. They stay open a little later. Their staff is there. I had them present just recently, not too long ago, at a service center that they were doing in the community, and fantastic. They're really, the numbers are building. More so, there's different agencies that are plugging into them so they can refer to them for the needs that they have in the community.
Yeah, it's really a great program, and I'm glad to see that they're up and running. I've been hearing that it's such a valuable resource, so we're super glad that that's another thing for folks to call on, especially for our young people. And another resource that we have, some people may know about the Mobile Crisis Unit. Some people may know it as 211 and then some. Let's talk a little bit about what that resource could be for folks and how you might activate it if needed.
We use 211 quite a bit for, different things from housing, but for the mental health part, I think it's been, they've been a lifesaver to us because it's somebody gets right on the phone. And I think we use it way more than we ever have in this last year, since this past winter. So it's very easy. You just call 211 and just keep pressing 1. I think it's 1 twice.
Mm-hmm.
And somebody gets on the phone, and if it needs to be escalated to where a person needs a mobile crisis to come out, they come out within a half hour usually. And even if it's not somebody that, I think the misconception is that mobile crisis means you're going to be signed into the hospital, you're going to be locked in somewhere. That is not the case. These people come out and talk to you and assess and make a plan. So if some degrees, if somebody needs to be hospitalized, that could happen. If it isn't necessary that they need to be hospitalized at the moment, they're still there to support you and make a plan to get you through to the next step.
Great. Now, we talked a little bit about 211. We also know that there's a new line that you can text and call, 988, which is the Suicide Prevention Lifeline. But there's also 911, and I think it's important for folks to know the difference and when it may be appropriate to call one versus the other. Let's talk a little bit about that. What are some of your user-friendly tips for that?
Well, knowing that 988 is a suicide and crisis lifeline means that someone can talk to somebody while they're in the middle of a crisis. And they don't necessarily have to be, 911 doesn't have to be dispatched. It could be that the 988 individual calling back to the person will sit and talk to them during the situation, and they'll determine whether someone needs to come out by the conversation they may have. Or it might just be a conversation the person needs to talk through, but they will also have someone come and check on them after. Once the call has been made, they're definitely going to send someone out to do a well check to make sure the person is okay within a period of 24 hours to make sure that person is still okay. And they are available 24/7, 988.
I have a lot of people that utilize them when they're going through that moment and they don't feel like they have anybody. It's a lot of late night calls or texts, and they literally are so supportive until they feel like you're done talking or their plan is in set. But I've seen some of my participants text them for a long period of time, and they feel supported. And not necessarily does it turn out to be, again, like 911 call comes out. It's just getting you through that moment to get you to the next level of what you need for help.
Right, and I think a good rule of thumb that I've heard is, 911 is really important for immediate threats to harm, self-harm or others, if somebody's already harmed themselves or somebody else. really that next step where you do need emergency assistance right away. So depending on what you're looking to do, if you're looking to talk or you want to be seen, you know, there seems to be something out there for everybody. So it's great to know that there's different resources out there for folks and that they're being utilized.
Mm-hmm. And there are times with 911 when I think individuals have called and they've come out, they've responded as they should, and also de-escalating maybe a situation for an individual and not necessarily have them taken away by an ambulance, or maybe found out more information about what's taking place at that present time. I can say I have intervened in some of those situations, not that 911 or the EMS or police have called directly, but I just happened to be present when this was taking place.
Right.
And they do know who we are in our community as well. So that's one thing that our EMSs, EMTs, and the police department are familiar to who the navigators and community health workers are in our community. So it's very helpful they trust us as well.
That's great that people know who the different players are. It's super important. So one of the things that we're very excited about locally is the new harm reduction center that has opened up at Alliance for Living. Certainly not a new program, but a new center with a little bit more access, something that's definitely a little bit new and different in this area and very much celebrated and needed. Trish, tell us a little bit about the exciting opening of the harm reduction center.
So we have the only harm reduction center in Eastern Connecticut, and it is a place where people can go to be safe, not be judged, not be treated differently. It is, excuse me, it's open Monday through Friday right now, 10:30 to 5:30. We have food, a place to relax, a place to rest, showers. We have instant access to providers. We have a mental health worker. We have a nurse. We have community health center on site on Fridays, haircuts, a respite area if you just need to lay down, or if you just need to have a conversation, or just get out of the elements, getting out of the rain, getting out of the heat, the cold, whatever. We're there to support people and keep people safe.
So important. We're so glad that it's here.
It's beautiful.
Yeah, and it seems like, you know, again, a lot of people, when they first hear harm reduction, they're thinking substance use, but we do know that it sounds like no matter what's going on, if you need a friendly face, place to get out of the sun, that might be a good option. And that's right on Broad Street at Alliance for Living, right?
Yep, it's 154 Broad Street, and you have, you know, it's designed for people with substance use and mental health. So we're there, and hopefully the hours will expand in the future. But you definitely have a lot of faces in there that are known in the community.
Yeah. Now, Margaret, tell us about what's going on over at the place. I know last night there was a mental health awareness night, but that there are weekly events. There's always something going on over at the place, as both of you know. For those people who haven't heard about the place yet, it's the Place for Community Wellbeing, and it's at 74 Garfield in New London. But tell us a little bit about what's going on at the place.
Well, you can find an event more than likely at their place almost every night. Often enough, they have gatherings that promote wellness, of course, because it is a place for community well-being, wellness, and they also have the bodega. They have different classes that are geared to community health. We have L&M sometimes they're doing certain promotional things to promote wellness with blood pressures, and sometimes we have asthma presentations there. It's constantly, you know, being used for like a Brothers Brunch, which is run through the Violence Prevention Grant. Monthly, they have a gathering of men who are community health worker room in Santiago, actually runs that program at the place. We have arts and crafts for mental health therapy, run by Paul Bustamante, who's a community health worker who does work does that on Friday nights. There's always something going on, and there's opportunity for organizations to utilize the place as well for some event that they may want to do in our community, and they would just have to call Light and speak to either Jen Mugio or Stephanie Clark to book or reserve the room.
Great. So a lot going on at the place. And I do know that there's a Facebook now for the place. So if Facebook is your thing, you can check it out and stay on top of all the happenings. So, one of the reasons why we're talking about mental health is, I think people like to talk about the post-COVID world and how, the loneliness and isolation that some people were experiencing hasn't really gone away, and in some cases has made a resurgence. So it's so great that we're talking about that today. Given all the things we've talked about already and your personal experience and your experience with working with people, tell me an observation you're seeing, and also what is the most rewarding part of this to you?
I think from COVID, I worked all through COVID, and I really feel like that COVID plays a big part of the mental health that people are still struggling with that isolation, being just not feeling connected anymore. I don't know. I just feel like I've never seen such an influx of mental health like we have in the last couple of years. And just trying to be more supportive to people, and why I do the work that I do. Is that it? Because people deserve to be treated with respect, with dignity. And I know what it's like not to be treated like that. So I feel like that's why I do what I do, is try to make this world a little better if we can.
Again, going to the COVID question, it's interesting how we recognize how COVID affected everyone, from children all the way to grandparents, or families, or children all the way to seniors. Again, like Trish said, the isolation, the disconnection, the inability for human touch, what was normalized in our lives for so long, for like ever, then came to a standstill. I think work relationships, even within work, people working and working from home and being at home with children all day, because everyone was now put in this position to have to regulate the way they move throughout their day or live their lives. I think took a toll on everyone, and also exacerbated maybe some mental health issues that people didn't recognize they had, or they were able to kind of overcome them in a sense by what they were doing on a daily basis, because their routine was the same.
Right.
Or navigate through them, because they were doing things that were healthier, like going to the gym, or things that would promote wellness, and some of those things were stopped.
Right.
And they didn't know how to pick back up on those things.
Right.
Yeah.
So lastly, most rewarding part real quick?
I don't know what else to do. This is how we look at our work. This is how we live. This is how we breathe. We do take time for self when we can. We try, but this is what I think we've been called to do in our community.
Fabulous. I can't thank you both enough for being with us today. Thank you so much for your time and energy. What a pleasure.
Thank
you.
And to our viewers, thank you so much for tuning in with us today. We hope you'll join us again right back here on Health Watch.